How's it going, everybody? My name is Romir. Thank you so much for stopping by to watch my presentation. Today, I'm going to be presenting on methaqualone, and I'm just going to be covering a basic review of its history and its current status in clinical and scientific research. So, just for some background on methaqualone, or known by its street name, Quaaludes. Methaqualone was first synthesized in the 1950s in India as an anti-malaria drug, and then soon it moved and debuted in the United States, so in the 1960s. And once it debuted in the United States, its primary function was to mitigate symptoms of insomnia and anxiety. However, after it was used primarily for those reasons, it soon became noted that it was a very addictive and potentially fatal substance. And this became more and more under public scrutiny because of a lot of other drugs at the time and the circumstances that were contributing to the war on drugs. So there were other drugs like crack cocaine and heroin that were being used consistently, and also it was just becoming a big epidemic for there to be like there being a lot of drugs in general that were being used. So methaqualone soon became under the radar, and it was noted that it was a very addictive and potent drug. So by 1981, the DEA ranked methaqualone as the second most used drug in the United States, second to marijuana. And then by 1984, methaqualone basically disappeared in the United States due to extensive government policy and action. So this was mainly due to the DEA codifying methaqualone as a Schedule 1 substance, so the most addictive substance that you could use. And that even has implications today. So quaaludes are still extremely difficult to obtain. And the quaaludes that you would obtain today are not necessarily a facsimile of what was created in the 60s and 70s. It's very different now, and it's not the same. Uh, so generally, quaaludes are a sedative drug. They can create a high for a user just being taken as they normally would be taken. But they can also create a stronger high if you take the drug and then fight the urge to sleep. It's also used with alcohol a lot to create a drunk or sleepy high, and these effects last for around 6 hours. So it's a pretty strong drug, and it has a very withstanding effect. So moving on to the pharmacological properties of methaqualone. So the methaqualone chemical formula is C16H14N2O. The pharmacokinetics. So methaqualone takes about 2 hours to be absorbed. The metabolites are excreted through urine. The distribution half-life is less than an hour, but has an elimination half-life of 10 to 40 hours. So it actually is sustained in the body for a very long time compared to other drugs. After absorption, methaqualone is deposited into tissue and it's released periodically over several days, being released mainly through urine and fecal matter, and this lasts for about a week. So methaqualone, as I said before, stays in the body for a long time, and even though the effects might not last as long compared to how long it's in the body, it's having an extremely detrimental effect over that period of time. For the pharmacodynamic perspectives, methaqualone modulates GABA, which, for a quick refresher, is the major inhibitory neurotransmitter in the brain. So any stimulation of any GABA receptors generally leads to more euphoria and analgesic effects. So methaqualone specifically stimulates GABA A receptors, and this generally leads to lower blood pressure, lower pulse rate, and overall just higher levels of relaxation and euphoria. And methaqualone is very similar to a lot of other sedatives. So methaqualone was used consistently with alcohol, just like a lot of other anxiolytics at the time, like barbiturates and benzodiazepines. So it is it's typically gets its effects through modulating and having inhibitory effects on specific brain areas. So moving on to the methaqualone use and abuse. Long-term usage of methaqualone generally leads to drug tolerance, dependence, and just very adverse withdrawal symptoms if you extinct the behavior of using it. When taking excess methaqualone, generally it results in a respiratory depression. Coma and death do occur, but a respiratory depression is very common, especially if you take methaqualone with alcohol. Having the two depressive drugs has a very strong effect on your respiratory system. So most individuals who overdose, it's generally having to do with respiratory. Um,
They can cause ataxia. Um, it's been found that quaaludes generally cause users to make poor decisions, and they just lack normal abilities under its influence. So generally, quaaludes have a very strong and indelible effect on decision making, and it's been found that driving skills of quaalude users are often impaired and can lead to fatal car accidents. So quaaludes have a very, very strong effect on cognition and behavior. So moving on to the prior research. So as I mentioned before, methaqualone or methaqualone, uh, it was virtually eradicated the from the public view in the 1980s. So a lot of the research that was done on methaqualone was done in the 60s and 70s. And then there's recently been a little bit of research on it, but it's more international just because it's still really difficult to obtain and use methaqualone today. So research was initially conducted just testing the efficacy of the drug. So Parsons and Thompson, they conducted this study assessing the benefits of methaqualone, comparing it to a different drug. And they basically concluded that methaqualone was a very reliable hypnotic drug and that there was no significant difference between the effects of 150 milligrams of methaqualone and 200 milligrams of cyclobarbital. So it was a very effective drug, and it definitely did what it was supposed to do. And this narrative of it being a very efficacious drug was furthered when it was tested with different clinical populations. So Cromwell conducted this double-blind, placebo-controlled study on 50 participants with anxiety disorder symptoms. These patients were mainly geriatric citizens, so they were the average age was 79 years old, and mostly women. In the study, it was found that methaqualone improved the conditions of 30 of the patients, with there being a significant difference between patients who improved with methaqualone versus the placebo. So methaqualone definitely helped individuals dealing with anxiety symptoms and insomnia, but like I said before, it soon became known and understood that methaqualone was a dangerous drug to be prescribing people. So DeStasio in 1973, they noted that all of the implications of methaqualone abuse in the United States. So in their paper, they discussed how methaqualone was generally being used with alcohol and it was also being combined with other drugs like heroin, barbiturates, and methadone. And they elaborated on the interactions of those drugs by noting that methaqualone, in combination with those other sedatives, causes a synergistic effect. So basically, just bolstering the effect of methaqualone in general, causing it to potentially be fatal. Methaqualone use was co-occurring with heroin use at very, very alarming rates, and there were thousands of deaths that were occurring from methaqualone. And this was noted in the early 70s. So this is when we started to transition into understanding that we shouldn't be prescribing and using this as much. Methaqualone was also being used in studies with animals. So, a study conducted in 1981 examined the effects of methaqualone on social sexual behavior in monkeys. So, there were three monkeys. They were all caged together and they were all injected with methaqualone. There were five experiments that were performed and they each lasted about 2 hours. And so, around the fourth trial, the male monkey attempted and succeeded at copulating with the other monkeys, or another word for copulating is just engaging in sexual behavior. And this basically supported the hypothesis that methaqualone has aphrodisiac potency. Basically, what they mean by that is that it has very strong effects on sexual behaviors. And this also, as I noted, added validity to the ongoing issue of methaqualone being used as a date rape drug. Quaaludes were very much used as a date rape drug in the 70s and 80s. So this basically empirically confirmed that it has strong effects, even in animals, on their approach and their engagement in sexual behavior. So for more recent research, that was some of the last research that was actually conducted on methaqualone before around 1984, when it was basically virtually eradicated from the public view. So this study and the next study I'm going to show you were both conducted internationally. So this study was conducted in 2022, and these scientists were interested in identifying the factors associated with patient treatment quality and the outcomes of substance use disorder in South Africa. So the study was conducted to guide the future creation of effective treatments for substance use disorders internationally. So they collected their data from 32 treatment sites. Each site implemented a service quality measure system, and they had over 1,000 patients in the study, most of which were men. And they collected data from the patients about their substance use. And one of the drugs that they collected information about was methaqualone. Even though they assessed a myriad of drugs, methaqualone is still a very much abused drug, especially in that area. So I chose this paper simply because I thought it was interesting that they were able to gather information about that. And even though it was sort of a polysubstance perspective on this paper, it was still interesting to note that methaqualone was one of the drugs that was being abused. And the authors of the study, they just concluded that individuals in the area, they reported suboptimal quality of treatment and limited access to substance use disorder treatment. And I sort of interpreted this as this lends to the ongoing problem of methaqualone usage in the area and the fact that there's limited access to treatment for extensive and detrimental drug use. And yeah, I thought that that was really, really interesting. And the next study sort of takes more of a less of a holistic perspective and more of a just an experimental perspective. But it was a study conducted also the same year, and they examined the interaction of substance use and sexual risk behaviors in young women in South Africa. And they had about 500 participants. And the authors concluded basically, pretty briefly, that methaqualone may contribute to HIV risk among young women in the region. So methaqualone, as I had mentioned before, has a strong effect on decision making, and specifically with regard to behaviors that usually require a lot of inhibition. Um, Methaqualone has a way of modulating those responses. So specifically with unprotected sex, methaqualone has a very strong effect on people, and they are more likely, if under the influence of methaqualone, to engage in unprotected and unsafe sex. Um, so I thought this study would be, even though this study only looked at women, I thought it'd be interesting to focus on men as well and to see how methaqualone usage in men affects things like engaging in risky sexual behavior and just in other behaviors that are generally risky. And yeah, so that was basically it for my literature review. I'm going to move on to more of the implications and my sort of analysis of everything. And so I just believe that the dearth of literature between the 1980s or the 1960s, 70s, and 80s, and now you realize that there's still a lot of unanswered questions, specifically how methaqualone has its effects on cognitive functioning and just general decision making and behavior. I think it would be really interesting to do a little bit more research on how methaqualone impacts psychological functioning instead of more physiological and somatic functioning. Just because if we were to use methaqualone at all, it would be important to understand how it affects people instead of just how it works for alleviating pain or alleviating symptoms of anxiety. And so I sort of continue with this and build on this a little more in the slide. So it would be interesting to try like an empirical study that effectively microdoses individuals just to test different effects, see how it works. There's a lot of laboratory paradigms that test cognitive functioning or that test memory and attention or behaviors like aggression. And it would be interesting to see how methaqualone um, influences those things. And it would also be interesting to do more research with different populations, just because I feel like the populations that we have access to, or that when methaqualone was being assessed, the population that the researchers were targeting were very biased. So the 60s and 70s, they mainly had all white samples, and then more recent research has been conducted in basically just South Africa or in Africa in general. So it'd be interesting to broaden our horizons with different populations and different groups of people. And just more research in general is needed to understand the effects of methaqualone beyond its sedative properties. It'll be interesting to understand what methaqualone's effects would be, not even just from a psychological standpoint, but also from a biological standpoint, how the stimulation of different receptors and different clusters of different receptor types, how it modulates those, or just the effects of long-term usage. And so that's basically it for my presentation. If you have any questions or comments or anything that you would like me to elaborate on, like any of the studies that I mentioned, please just let me know and I'd be happy to talk about it. Thank you again.